All right, good morning. So we are in the week of October 19th through the 22nd. This week we're covering cardiovascular system. So next week, homework 3 is going to be due. And also practical 3 is next week. So we have a break between the quiz and the practical for this unit. So yeah, and I can actually put it up on the screen so you can see it. Even better. All right, so we had our quiz over nervous system last week, right? So this week, covering cardiovascular system. So next Tuesday, we'll have a review for practical 3, or next Monday, rather. And then next Wednesday, we will take a practical over nervous system, special senses, endocrine system, and cardiovascular system. So that's next week, okay? This week, we're just covering cardiovascular system, okay? So make sure you're clear on that. All right. Scroll down to our section on the cardiovascular system. All right, so a little bit. Yeah, there you go. So we're going to start out with blood. In lecture, we're going to have a chapter on blood that we're finishing up today and then we'll start a chapter on the heart. So we'll start in lab on blood as well. So there's different kinds of blood cells, and if you're following along with your blank sheet, you can be filling this in. So majority of the cells on a blood slide are going to be red blood cells, okay? Kind of reddish, biconcave disc. You know that because they look kind of like donuts, because in your biconcave, you're thin in the middle. And so that's why it's very light in the middle, okay? Now, the cells with purple in them are white blood cells. So in lecture, you'll kind of learn about the different kinds of white blood cells. But for lab, just know that these cells are purple, have some purple in them. These are white blood cells, okay? Now, also for lab, what you need to know is these little fragments, these little purple dots, they're not whole cells. Those fragments are called platelets. So when you hear about giving platelets, if you give blood, you can give platelets, that's what they're talking about, using those fragments, okay? So that's what we want you to know, be able to identify if you see a picture or if you see a microscope slide on a practical, be able to know what those cells are. All right, on to the heart. So one of my truly favorite organs, maybe one of yours too. So with the heart, we're going to start out with the vasculature. This is just a fancy A&P word for blood vessels. So you think about the path the blood takes. You've got to send blood to the lungs to pick up oxygen, right? Then you got to bring it back to the heart to pump it out to the rest of the body so that the other organs in the body can receive oxygenated blood, right? So we'll start here with this big trunk, okay? This is the pulmonary trunk. Pulmonary is a word that basically means lung. So like a pulmonologist is a physician that works on lung diseases, okay? Pulmonary trunk branches to the left pulmonary artery and the right pulmonary artery, okay? Key point, arteries are going to pump blood away from the heart. So arteries away, okay? So if I can type that for you. Sure. Good. All right. Arteries take blood away from the heart. Veins take blood to the heart. Okay. So whether we designate or color these veins, or arteries and veins is red or blue, is whether they're oxygenated or deoxygenated. And keep in mind, this is more of a way that we add color to make it look a certain way. Okay. So the pulmonary trunk and the pulmonary arteries are blue because they have deoxygenated blood. That should make sense because they're going through the lungs to pick up oxygen. Okay, and you got to remember this is from the patient's perspective. So this is the left side. This is the patient's left. This is the left pulmonary artery. Going underneath the aorta is the right pulmonary artery. Left pulmonary artery goes to the left lung. Right pulmonary artery goes to the right lung. Okay? So basically blood's been pumped to the lungs, gone and into capillaries, picked up oxygen, coming back to the heart in veins. That blood is now what? Now that it's come back from the lung. It's oxygenated. So, and veins bring blood back to the heart. So these are your left and right pulmonary veins. So they are veins because they bring blood to the heart. They're red because they're oxygenated. And typically there's going to be two. It's like you have one artery on each side, but two pulmonary veins on each side. Okay. So these are coming back from the left lung. These come back from the right lung. They come back to the heart. Okay. Now that blood's oxygenated, getting ready to go to the body. And go through the aorta. And this is essentially what we call ascending aorta because it's going up. And the curved part here is the aortic arch, right? So, and what's an arch? A curved structure, right? So this is the aortic arch. The aorta also has, or the aortic arch also has branches. Okay, so it has the brachiocephalic trunk. Anybody remember what brachio means? Arm. What does cephalic mean? Anybody know that one? The head. Very good. So it's going to go to the head in your arm. Okay. Then we got common carotid artery. Okay, tends to go to the kind of throat area. Left subclavian kind of goes toward the clavicle. Should make sense. Subclavian. Okay. So from there, you're sending blood out to the body. Okay. You also have further branches in the descending aorta going towards your legs. Okay. Of the lower parts, the more inferior parts of your body. Okay, so send that down to capillaries in different parts of your body. It's shooted that oxygen or diffuse that oxygen out. Blood's now deoxygenated. Got to come back. Okay, from the superior portion of the body, blood returns to the heart via the superior vena cava. Vena, another word for vein. Superior, upper, right? Inferior vena cava. The inferior is lower. It comes from the lower parts of the body. It's also a vein. And they are blue because they are deoxygenated. Okay, so that's the basic path of blood flow. Will help you with homework 3. Okay, also shows you to kind of orient you. This is where the left atrium is. We'll see another view of that on the next slide. Okay. So before we move on to the next slide, I want to stop. Most of your tables should have a heart on the table. If you don't, I'll bring a heart to you, or a heart model. I want you to go ahead and start looking and identifying those structures. And you can be doing this at home as well. Okay. So let me get rid of the annotations. Here we are. Okay, so this view basically takes like a frontal section. Okay, so we're able to see a few more structures this time. So in this view, you can see here's that left atrium again. Okay, so oxygenated blood's coming into the left atrium from these left and right pulmonary veins. Okay, so you can't really see it, but these right pulmonary veins are kind of coming behind here and emptying it to the left atrium. Okay, I'm going to go through the left atrioventricular valve. AB valve for short, also known as the bicuspid valve, because it has two cusps. Okay, and it's going to go flow into the left ventricle. Okay, now the left ventricle has a lot more muscle tissue in it. You can see a lot of muscle down here, right? Cardiac muscle. And when that heart contracts, it's going to push the blood back up. These cusps are going to close over here. So they only open one way. Okay, so they basically close these up going back so you don't get much backflow. But blood will flow through this aortic semilunar valve. And it's called that because it feeds into the aorta. And semilunar because it looks kind of like a half moon. Okay. So again, blood flows to the aorta and goes out to the body. Okay, it's going to come back to the body via the superior vena cava and the inferior vena cava. Okay, it's going to flow into the right atrium. Remember, patient's perspective, right? This is the right side. Blood then will flow through the right atrioventricular valve, also known as the tricuspid valve or right AV valve, into the right ventricle. Again, when that cardiac muscle contracts, push blood back up, closes the atrioventricular valve that opens the right or pulmonary semilunar valve. Okay, so this one is the pulmonary semilunar valve. Over here you have the aortic semilunar valve. It's pulmonary, okay, because it's the oxygenated blood going back to the lungs. And you should be able to see now, this is a better view, that it looks kind of like a half moon, or two half moons, okay? So this is your pulmonary semilunar valve, right? Goes to your pulmonary trunk, to your left and right pulmonary arteries, okay? Blood comes back to your left and right pulmonary veins, back to the left atrium. Start the process over and over again. All right, so I'll give you a minute to look over the structures on your heart models. You can do this at home too if you have your fill in the blank sheet. All right, so on your homework 3, they asked you about the pulmonary circulation and the systemic circulation. See if I can just so slightly. There we go. All right, so pulmonary circuit or pulmonary circulation is taking blood to the lungs, right? Pulmonary means lungs. So going to your pulmonary trunk, to your pulmonary arteries, taking blood to your lungs, okay? Blood's going to go into capillaries with the lungs where gas exchange can occur. Because they're so small, it's an easy place for diffusion and exchange to happen. All right, so the capillaries are going to accept oxygen because the concentration is lower inside the capillaries, right? So high to low, right? It's going to bring it in. And you're going to essentially release CO2 because that concentration is higher in the capillaries. And it's going to go out into the lungs and you can exhale that CO2. All right, so that's gas exchange. Now you got oxygen, bring it back to the heart. And again, to the left atrium, down to the left ventricle, Out through the aorta, go to the different branches of the body. This is the systemic circulation or systemic circuit going to your different organ systems, right? Then you have gas exchanges and nutrient exchange with the capillaries. Okay, so that way your muscles and all your other tissues can get oxygen. Okay, and that deoxygenated blood goes through the inferior and superior vena cava back to the right ventricle. Okay. And again, oxygen rich is red, oxygen poor is blue. And if the blood is oxygen rich, it's also CO2 poor. If the blood is oxygen poor, it's also CO2 rich. Okay. So the right ventricle and right atrium, yes, they take in the deoxygenated blood. All right. Show you here, so you see a slide of blood vessels. So this is kind of analogous in the integumentary system. We talked about thick skin versus thin skin. Okay, you should be able to visually tell the difference. You should be able to tell the difference between an artery and a vein. Arteries have a lot more muscle tissue, smooth muscle, right? So the type of muscle tissue that arteries and veins have is smooth muscle. And you have a lot more muscle, and they're a lot larger than veins. So your arteries have a lot of musculature to move that blood through the body. Veins, a lot of times, blood is getting pumped back to the heart due to the force of things around it. Okay, so they don't necessarily need the muscle tissue. Okay? You should be able to tell the difference between the artery and a vein. All right, let's talk a little bit about different arteries and veins you need to know. Okay, so these are arteries you need to know. You know they're arteries because they are colored red here. Okay, again, don't worry so much about memorizing as much as I want you to learn the names of the words, and that'll tell you where they go. Okay? So we'll start at the heart. Again, here's the ascending aorta moving up toward the aortic arch. Okay, remember you've got your branches, brachiocephalic trunk. Okay, and so here you've got the subclavian arteries going toward the clavicle. Okay, now you've also got in the throat common carotid arteries. In the armpit area, axillary artery, remember that's what axillary means. In the arm, brachial means arm. This is brachial artery. Then you're going to split. That brachial artery is going to divide into the radial artery and the ulnar artery. How do you tell the difference? Remember the radius is on the thumb side, right? Pollex, more lateral. Ulnar artery is more medial. All right, when you get to the hip area, the os coxae, you have the common iliac artery. Remember iliac, ilium? Should remember that term. Okay. Branching off of that, you're going to get the femoral artery. Why do you think we call it femoral? Because it's near the femur. Okay. Down the lower leg, we've got the anterior tibial artery and posterior tibial artery. Okay. Why do you think we call it
This is for the bottom.
Right, near the tibia. Anterior means toward the
Oh, interior means
front. Posterior means
back.
back. So it's kind of hard to see here, but you're gonna have to, in your mind, perceive that the anterior, like, it looks redder because it's more forward. Posterior is fainter because it's more behind you. Yes. So again, don't get too caught up in the words, or don't get caught up in trying to memorize everything. Try to learn the words so that you kind of go, oh, this is this body region. Remember back in week 1, week 2, I made you learn all these body regions and landmarks and all that stuff? And you all were like, why do I have to learn all these words? This is why you got to learn all those words. Makes it easier. All right. Now let's look at the veins. So for the veins, again, if we start toward the heart, remember so actually we'll go, since we're bringing blood toward the heart with the vein, let's start with the vein. So again, just like it's in that clavicle area, subclavian vein. In the throat area, we call that internal jugular vein. Okay, this area is kind of branching that where you get all of these other offshoots going to the arms and the head, or coming from the arms and the head, are the right and left brachiocephalic veins. Okay. Why are veins blue? Because they are deoxygenated, and they've already given up their oxygen to the when they. So good question. And all of these are going to feed into the superior vena cava. Okay, from the arm. Remember the radial side is the thumb side, so radial vein. Medial side is the ulnar, where the ulna is, ulnar vein. Okay, feeds into the brachial vein. Okay, also, again, goes toward the brachiocephalic veins and to the superior vena cava. Yes?
So will veins feed into the superior cava?
For the arms and the head. Because remember, brachiocephalic is arm, head. Brachio, arm, cephalic, head. So all of those veins are going to feed here. Okay?
So the artery is feeding to the aortic.
So it's the opposite, because they're thinking of the direction of blood flow. So the aorta is sending blood out to the body, taking blood away from the heart. Because arteries take blood away from the heart, plus it's oxygenated. So they're sending oxygenated blood to the tissues. The veins are bringing blood back. So that's why I started at the heart for the arteries, but I'm starting at the veins. I'm starting at the veins for the veins because they're going toward the heart. So all those veins are on the arms and the head are going to feed into the superior vena cava. All the veins in the legs, in the hip, in the abdomen, are going to feed into the inferior vena cava. Okay? So it just takes a while to kind of get that down. But again, big picture, arteries take blood away from the heart, veins bring blood to the heart. Okay, so if you remember that, so arteries away, veins feed.
Bring blood, oxygenated blood.
They just take blood away. So, because you have the pulmonary artery, it's an artery. It's carrying deoxygenated blood away from the heart. It's going towards the lungs. All right. The aorta is also an artery. It takes blood away from the heart, but it has oxygenated blood. So basically, colored is about oxygenated versus deoxygenated. Artery versus vein is what direction is it going. Good question. So for the legs and the tibia, we've got the anterior and posterior tibial vein. Okay. This is more toward the anterior. That one's going toward the posterior. They feed into the femoral vein. located by the femur. Okay, they're going to feed into the common iliac vein. You also have this internal iliac vein that basically supplies your groin area, and that also feeds into the common iliac vein. And both of these common iliac veins for both your legs will feed into the inferior vena cava. And those will go toward the right atrium. Okay. So this is kind of the information you need to do those slides for homework 3. Okay. So you'll be making your own version. Okay. Like I said before, don't just give me a picture that already has everything labeled. I want you to label it. Okay. You can find a picture, but I want you to label it. Okay. All right. So that is what you need to know for the cardiovascular system. So we'll review this on Wednesday, but I would get your tables. You all have, most of your tables are going to have a model where you can see the arteries and the veins. So I want you all to practice that. Okay, go look through those so you can identify them for yourself. So, all right, pause.